Aboriginal and Torres Strait Islander peoples are warned that the following content may contain images and voices of deceased persons.
We honour the land that we're meeting on. We sing respect, loud and strong, connected by a living land.
Acknowledgement of country is more than a simple ritual. It's an important first step towards understanding, mutual respect and cooperation. Aboriginal and Torres Strait Islander people have a strong connection to land and culture. In honouring that, we pay respect to both past heritage and to the resilience which makes Aboriginal and Torres Strait Islander culture remain strong today. In honouring the elders of past, present and future, we acknowledge and respect the contributions made by people from within communities towards developing Aboriginal and Torres Strait Islander health-focused programs. And we acknowledge and respect those still to be made relating to programs and services yet to be developed. When we perform acknowledgement of country, we strengthen the foundation upon which all of our combined efforts to address Aboriginal and Torres Strait Islander health issues are built.
Healthcare executives can enable a whole-of-organisation approach to addressing the closing the gap targets relating to health. We can do this by supporting strategies that enable accurate identification of patients at all entry points. This should become an established process that enables the pathway to safe and effective care.
The National Safety and Quality Health Service Standards have 6 new actions specifically designed to help Aboriginal and Torres Strait Islander people accessing healthcare. Version 2 of the standards integrates these actions after identifying compelling reasons for the additions. These reasons include reflection of the historical and contemporary context of Aboriginal and Torres Strait Islander health, while also recognising the unique and diverse cultures of Aboriginal and Torres Strait Islander peoples. The 6 new actions are incorporated within Standard 1, Clinical Governance, Standard 2, Partnering with Consumers, and Standard 5, Comprehensive Care. Action 5.8 in Comprehensive Care states, the Health Service Organisation has processes to routinely ask patients if they identify as being of Aboriginal and/or Torres Strait Islander origin, and to record this information in administrative and clinical information systems. This aligns with the existing strong evidence base recommending a national standardised approach to asking the Aboriginal and Torres Strait Islander question of origin. It supports a process so that the question is asked exactly as worded and recorded exactly as answered of all people accessing health services.
Aboriginal and Torres Strait Islander people may present at health services at a much earlier age with chronic conditions than the population average. So accurate identification will enable healthcare providers to offer evidence-based and aligned health pathways while also providing appropriate referrals and support for ongoing management. Early recognition and management of health conditions specific to Aboriginal and Torres Strait Islander peoples will support better health outcomes and actively work towards closing the health gap. Self-identification in response to the standard Aboriginal and Torres Strait Islander status question is the most accurate means of establishing a person's Indigenous or non-Indigenous status. Important to note is that asking the question of origin is mandatory, but it is not mandatory for a person to answer. Incorrect or incomplete data affects the ability to identify and monitor specific health conditions and health outcomes in the Aboriginal and Torres Strait Islander population. Identification also helps us better understand people's preferences in the health services they access and which services and policy interventions will produce the best outcomes for our whole population. Having access to this reliable data is essential for measuring the effectiveness of health services and for further policy development, planning and continuous improvement in service delivery.
Aboriginal people don't use the hospital system as much as they should be because of past. When I say past, history might be further past or really recent past. Family members from your grandfathers to your mothers pass that down as generational. Because of people going there having babies, I'll use babies as an example, getting removed from their families. People going there and being tortured. When I say tortured, feeling sick, and feeling sick and getting worse, and they're going there to die. And our old fellas, especially old fellas, they don't like going there because many of our old fellas go there and because of their spirituality, they will pass away. And if that's passed on to your kids or your grandkids, they're going to see that and they're going to feel it.
We work together right across the hospital setting. We have people that support us within an Aboriginal health unit setting as well. You're not a lone person anymore.
The team effort is the most important. People taking notice, them feeling comfortable by coming into our health service, the flag raising out the front, the respect that's given when there is a death within the community by flying the flag at a half-mast, the Aboriginal artwork that's on every ward. They feel comfortable just having faces on walls that they recognise as part of the health journey. This question is worded exactly the same on the Australian census, ABS household surveys and other major data collection. Changing the wording even slightly has the potential to alter the meaning, and this may in turn influence the person's response. It's really important that the question be asked correctly and consistently of all people. Staff must not modify the question in any way.
Information systems should record all status information using the national categories for recording Aboriginal and Torres Strait Islander status, as set out in the National Health Data Dictionary. The categories are Aboriginal but not Torres Strait Islander origin, Torres Strait Islander but not Aboriginal origin, both Aboriginal and Torres Strait Islander origin, neither Aboriginal nor Torres Strait Islander origin, 9. Not stated or inadequately described.
Asking the question allows health providers to ensure access to appropriate health services and for health workers to deliver health checks. It is necessary to ask so we can plan and deliver health services for all Australians, and to assess impact on particular groups to monitor change in health and well-being.
To not ask a person this question is discrimination, which infringes upon the person's right to respond to this question for themselves. It's about effective care, fixing the gaps and improving the patient's journey.
This is one of many questions asked. We can never assume a person's status, and it can only be determined by asking each person the question.
Closing the gap is about making Indigenous health everybody's business.
All people have the right to report their status as Aboriginal or Torres Strait Islander. Asking the question in a standardised format allows this to happen.
You need to ask the question, and that journey for them will be, the outcome at the end of it will become a lot better.
Sometimes it's a lack of awareness, simply because staff have not been offered training in how and why to ask the question. So staff may be hesitant to ask the question because they don't know what to say if the person queries why they're being asked it. A person's refusal to answer the question may be due to lack of information and being rushed through the registration.
All staff who are responsible for registration should ask the status question at all admission points.
So staff must always ask the question, regardless of their own views, and not make assumptions.
Staff should collect information from all people in a professional and respectful manner.
The question should be asked no matter what they look like, their country of birth or their family background.
Regardless of how dark your skin is or how light your skin is, Aboriginal people, if you're brought up and born Aboriginal, you're an Aboriginal. Because the spiritual connection with Aboriginal people, regardless of the skin colour or light skin colour, is very strong.
Hello, my name's Karen. How can I help you?
I'm here for admission.
Okay, I'll just get you to fill out this paperwork.
Yep.
So when you ask the question, treat it no less sensitively than any other item of personal data collected from the person.
There should not be question or comment to a person's response. It should be recorded and not changed in any way to reflect views of any staff member.
Clients have the right to disclose or decline to answer this question, and no proof of Aboriginality is required at mainstream services.
There we go.
I've just noticed you haven't completed the box that says whether you're Aboriginal or Torres Strait Islander origin.
What do you want to know that for?
It's a standard question we ask of all patients attending health services.
Oh, okay.
All people should have the opportunity to confirm or alter their status.
It's really important to check registration data and follow up missing information as soon as possible.
Any changes should be received without comment. People should not be required to provide any reason or explanation.
It's really important not to anticipate or assume about a status.
Or about how the person is likely to react or respond to a question.
If a person declines to answer, they should be informed that their level of care and access will not be affected if they choose not to answer.
Hello, my name's Karen. How can I help you?
Hi, we'd just like to see a doctor.
Okay, sure. I'll just get you to complete this paperwork.
There is often a lack of privacy when asking and answering the questions, so just be aware of the surroundings.
All personal information is protected by a strict Privacy Act. Information is never shared without consent.
When you're asking the question, keep it really simple and be honest and confident.
And if we can get people to be more confident to ask that question in just a natural way.
Them little minor things Aboriginal people pick up on straight away. It could be the smallest thing, even eye contact or non-eye contact, as long as that body language is right.
We just want people to feel confident and ask that question and ask it every time.
Thank you. I've just noticed you haven't completed the question whether you and your baby are of Aboriginal or Torres Strait Islander origin.
Yes, we are both Aboriginal.
That gives the person on the other side who's being asked the question that confidence that we're just asking that so that we can improve health outcomes and close that gap.
It's extremely important to ask the question of origin because it starts the journey for a better outcome in the health of that person.
Aboriginal people's health journey is everybody's responsibility.
All of us, we've all got a responsibility. We work in a health system.
By asking the question of origin at the start, the most important, this will connect them to the services they require.
The second edition of the National Safety and Quality Health Service Standards User Guide for Aboriginal and Torres Strait Islander Health recommend health service organisations develop a policy, business rules, procedures and protocols on Aboriginal and Torres Strait Islander identification to ensure that higher identification rates are achieved through continuous quality improvement initiatives.
Thank you for your time today and for your future efforts to support the correct, consistent collection and recording of Indigenous and non-Indigenous status. Thank you for supporting a process which enables the planning and provision of appropriate and improved healthcare for all people.
It's time to rest.